Back to our patient who has a limitation in extension, for example, right? We'll call him an extension bias patient. But he's got this old injury. So if we just gave him extension, how likely is it that the L4 segment is going to move? It's probably unlikely. I'm going to leave you off the hook, Mariana, and not ask you to make a comment. This is my statement. It's probably unlikely that in an adhesed, potentially scarred down back, that it's probably not going to move. And we could do extensions out the wazoo all day long, and we're going to get movement above the level and movement below the level, but likely not get too much movement at the offending level. What the Maitland therapist would do, what I would do with my Maitland and McKenzie, is I would mobilize central PA on L4 to restore movement at L4 using the comparable sign. When I push on that, what do you feel? Yes, that's it. That's my pain. Great. So I'm going to mobilize it in a certain way using a certain grade of movement, yada, yada, yada. Now get up. Now let's see what you can do in extension. So now that L4 has a chance of moving, right? So the two are not combative. The two, McKenzie and Maitland, are complementary. My problem becomes that in certain, this is going to get controversial, but that's okay. In certain parts of the world, I'm not even going to say the McKenzie Institute, okay? I'm letting them off the hook. McKenzie practitioners that I know of, we'll leave it at that, don't really teach passive physiological or passive accessories because of the concept of empowering the patient to treat themselves. And we have no problems with that either. Maitland therapists, we want to get the patients self-treating as soon as possible. And the treatment we give them is driven by what we see in the clinic, just like the McKenzie guys, right? Guys and girls. So in parts of the world, McKenzie teachers are teaching active physiologicals, passive accessories. In other parts of the world, passive physiologicals and passive accessories are not being taught. My question, the $64,000 question, is why? Right? Mm-hmm. Based upon that little clinical vignette we just talked about. Mm-hmm.